Lab 3 palpation for gross 1. Radius and ulna, anterior arm and forearm. First, we are going to palpate two features of the radius, the head and the styloid process. Next, we will be palpating three features on the ulna. We will be palpating the olecranon process of the ulna. We will also palpate the head of the ulna and the styloid process of the ulna. First, the head of the radius. Have the forearm extended. The head is in the depression just lateral and posterior to the tip of the elbow. The styloid process of the radius is at the distal lateral aspect of the forearm. Go lateral at the wrist joint. On the ulna, we are first going to find the olecranon process. Have the forearm flex at the elbow joint, touch the tip of the elbow. That is the olecranon process. The head of the ulna is the rounded knob at the distal posterior medial aspect of the forearm. The styloid process of the ulna is the small bony feature just inferior and medial to the ulnar head. Do not cross the wrist joint on this feature. Next, we're going to work for some muscles. Biceps brachii is first. To palpate this muscle, go to the anterior aspect of the arm. It is the superficial muscle on the anterior aspect of the arm. To test, have the patient flex their forearm against resistance. The bicipital furrow is also in this area. Have the patient raise and flex their arm. To palpate the bicipital furrow, find the depression under the biceps brachii muscle on the medial aspect of the arm. The brachialis muscle is next. To palpate the brachialis muscle, go to the distal end of the bicipital furrow, deep to the biceps brachii. To test, flex the forearm against resistance. You must provide considerable resistance on this muscle test. The pulse of the brachial artery is in the same area. Go to the midpoint of the bicipital furrow and press firmly with the middle or index finger. Do not use your thumb. Next is the ulnar nerve. You are going to palpate the ulnar nerve by attempting to stimulate the ulnar nerve. Go just lateral to the medial epicondyle of the humerus. You are trying to find the groove for the ulnar nerve. Next is the flexor carpi radialis muscle. You're going to palpate and test. To palpate, have the patient flex and abduct, which is radial deviation, their hand against resistance. You will be palpating the tendon about 1 inch from the lateral side of the distal forearm. Next, palmaris longus should also be in the area if it is present. To palpate this tendon, go just medial to the tendon of the flexor carpi radialis. To test, have the patient flex and touch the ends of their thumb and little finger together. If there is a palmaris longus, it should stand out. Next is the tendon of the flexor carpi ulnaris. To palpate, go to the distal medial aspect of the forearm. To test, have the patient flex and adduct, which is ulnar deviation, their hand against resistance. Next is the radial artery. You will be taking a pulse of the radial artery. Go just lateral to the tendon of the flexor carpi radialis. Make sure the hand is extended. You should feel a pulse. The ulnar artery. You're going to take a pulse of the ulnar artery as well. Go just lateral to the tendon of the flexor carpi ulnaris and press firmly. Next, we have two muscles. The flexor digitorum superficialis. We are going to palpate the tendons close to their insertion point. To palpate the tendons, you're going to go to the hand just proximal to the proximal interphalangeal joints, the pip joints, of digits 2 through 5. To test, you're going to have the patient flex the digits at the pip joints. Next muscle is the flexor digitorum profundus. To palpate these tendons, you're going to move down the digits, go just proximal to the distal interphalangeal joints, the dip joints, at digits 2 through 5. To test, flex the distal phalangeal joints, the dip joints, at digits 2 through 5 against resistance. Next muscle is the flexor pollicis longus. You are also palpating the distal tendon on this muscle. Go just proximal to the interphalangeal joint of digit 1. To test, flex the interphalangeal joint against resistance. Next muscle, pronator teres. To palpate, find the cubital fossa. Go distal. Pronate against resistance for the test. Last muscle, pronator quadratus. This muscle is deep, so you cannot directly palpate. So you will be testing this muscle only. First, have the patient completely flex their forearm. Second, have the patient pronate their forearm while providing resistance. That will show the pronator quadratus is functional. This is the end of Lab 3 palpation.